Phase 1 is when the person is first experiencing symptoms of Parkinson's disease.
Hey honey, are you ready to go to the mall?
Yeah, hold on, just give me a minute. I'm gonna get my jacket, okay? Wait. Oh.
Are you okay? It looks like you're struggling putting that jacket on.
Yeah, I've been having some pain, and I don't know, I can't do many of the things, and I feel stiff sometimes, and I just don't feel good.
Maybe we should go to the doctor and get it checked out.
Yeah, I think that's a good idea.
Yeah? Okay, let's do that.
People in this phase often feel annoyed that their body does not work as usual. Phase 2 is described as when the person starts to perceive a new life. Getting a diagnosis can be viewed negatively or positively. Negative in that people speculate on the changes the future will bring. It can be viewed positively because it relieves people of anxiety and despair, and also means that symptoms could be explained.
Good morning, I'm Dr. Wu.
Hi, I'm Daisy.
How are you today?
I'm okay. I've been experiencing some problems lately, and I've been finding it hard to get up from the chair and to keep my balance, and I feel stiff in my arms and my shoulders. I'm starting to get all shaky when I'm laying down, and I've been also having massive headaches, which I can't even get rid of with analgesics, and it's starting to affect my life. It's very hard because even to do simple tasks like getting up from my chair and brushing my teeth, and I don't know what's wrong with me. Do you think you can do anything to help me figure out what's going on with me? It feels like I'm completely dying.
Well, sure. I think we need to run some tests on you, and based on the test results and the symptoms, we can figure out what's going on with you.
That'll be great, thank you.
So, we've got your results back, and it seems to me that you have Parkinson's disease.
Is this serious, or am I dying or something?
Well, Parkinson's disease is a progressive neurodegenerative disorder of the brain caused by a gradual loss of the nerve cells in a part of the brain that is responsible for the control and regulation of body movement and coordination. Normally, these nerve cells produce a neurotransmitter called dopamine, which plays an important role in the regulation of body movement. In Parkinson's, there's a deficiency of dopamine due to the loss of dopamine-producing cells, which results in nerves sending signals at an irregular rate to the muscles and limbs. This change in neural activity is primarily responsible for the classic manifestations of Parkinson's disease. So far, there's no cure, but we can make it under control by giving medications. So, here's your prescription. And the nurse will come to you shortly to set you up with your treatment plan.
Okay, well, I'm just very glad that I'm not dying.
You're not dying.
Hi Daisy, I'm Shauna and I'm your nurse today. How are you today?
I'm great.
That's great. I just heard about your diagnosis and I was wondering if you have any questions and concerns about Parkinson's disease.
Well, I don't have any questions at the moment. I'm just very relieved that it's nothing serious, nothing deadly, and it feels better that I'm not going crazy or anything.
Oh, that's a positive way to look at the situation, especially since you will have to be making a lot of changes in your life now. Your perspective on Parkinson's disease is important, as being positive will help you cope with the situation. How do you feel about this?
Well, I don't understand why I got this disease. Only old people are supposed to get Parkinson's disease. This is not it's not fair. I'm not old. I don't even have any kids, and it's just tad ridiculous. Also, you think I can go back to living my normal life? I'm just wondering if there's any treatments that can help me get rid of this, that I can just be back to normal where I was a long time ago.
It seems like you have a lot of questions and concerns. You can still be able to manage your life with some modifications with your diet and exercise. As you're still in the early age, your symptoms can be controlled by medications.
Well, it seems like I'm going to have to do lots of work. I guess I just have to live with it. It's not, I can't do anything about it.
I can only imagine how scary and overwhelming this must be for you, especially having to think about changing your whole entire life just because of a disease. How do you feel about making a health promotion plan with me so we can work together to effectively make these changes?
Well, that seems like it would be very helpful, and I have no idea where to start these changes, so thank you.
In phase 2, people are anticipating what their life and future will now become after the diagnosis of Parkinson's disease. Phase 3 is when the client recognizes the need to take control of his or her life. In phase 3, people with the disease noted that they became slower in their movements and found it harder to concentrate. Their need for medication had been more frequent and the doses needed to be increased.
Honey, I really need to tell you something.
What is it?
Well, I sort of have a confession. These medications are not working as well anymore. I've been finding it a lot harder for myself to get up out of bed and walk. I'm like walking like really slow. And I think we should talk to the doctor to increase like the dose on it or like the amount on it. So I just feel like it's not working for me anymore.
I'm sure it's nothing, honey. I think it's just you're tired. I don't think it has anything to do with your dosage or your condition.
Well, if I'm tired all the time, I feel like I can't even cross the street anymore. And I've just gotten a lot. Like, the street seems like it takes forever to cross. And even the other day, I was like halfway across the street, and a hand appeared on the sign. I mean, it's just I wasn't able to get across the street.
I think you're just tired. It's okay, honey.
But I've also noticed that before, like when I take the medications, it lasts for like hours, and now it just feels like it wears off just all of a sudden.
Maybe we should talk to the doctor then.
Well, yeah, but we also should. I mean, like the other day, I totally missed my dose, and at one point I wasn't able to move. I couldn't like move my hands or feet, and like just everyone was staring at me, just like really, really scary.
What? You should have told me this. It's really important for you to take your medication.
I know, and that's why I'm concerned. Cause what if the medications stop working altogether? As well, I mean, like I don't want to freeze in the middle of the road when I'm walking, cause that would be like really embarrassing and really dangerous. What if a car is coming by like really fast?
Yeah, we should tell this to the doctor. And I think you need someone with you every time you go for a walk or anything like that, okay?
I feel like this disease is really taking over my life. I really need to get straightened out with the doctor. I mean, this is ridiculous.
People in phase 3 started to feel that the disease was gradually taking control over their life. In phase 4, people with Parkinson's disease struggle to stay in control. A strategy to take control is by trying to manage the unpredictability, which would be by being positive and living according to routine. These strategies to stay in control helped facilitate having a normal life, reducing the need for the help of others, and being able to self-manage symptoms of Parkinson's disease.
Good morning, Daisy. Good morning. How was your sleep? Was good? I'm just gonna do the equipment check quickly. So how was your sleep last night, Daisy?
It was okay.
Yeah? Okay. Do you know where we are today?
The women's center.
Yeah. And
Downtown.
yeah. And do you know what day it is today?
Maybe it's Wednesday of 1992.
Oh, it's actually Monday, 2012 of March.
You mean it's not winter outside and it's not all snowy and pretty?
No, it's almost summertime, but it's 5 a.m. It's kind of dark. I can't. Okay, so just before I get you ready for breakfast, I'm gonna do your vital signs. Okay? I'm just gonna come around to the other side.
Okay.
Okay. Just gonna use the arm, and I'm gonna put the blood pressure cuff on you. I'm just going to put the cup around your arm. I'm just going to start the blood pressure, okay? It's going to inflate. Okay, it seems like your blood pressure is 114/66. I'm just going to check your temperature, so open your mouth and we're just going to put it under your tongue. Okay, and we're going to close. Perfect, it's 37.0. And then I'm just going to check your oxygen level that's going through your blood, your body. Great. 99%. Okay, so I'm just gonna go prepare your medications, and I will be back, okay? I'm just gonna put the bed rails back up and put the bed down. Would you like anything before I leave? Maybe some water? No? Pardon? After? Okay, perfect. I'll be back, okay? Daisy, I got your medications for you. Just gonna check your ID band. Can you spell your last name for me?
C.
Perfect. And your birthday?
January 21st, 1929.
Okay. I'm just gonna raise the head of the bed up so we can give you your medication.
Okay.
Are you comfortable? Yeah? I'll just get rid of the pillow. So you're more comfortable. Perfect. Just gonna raise it up. Gonna hold on the side rail. Okay, and I'm gonna raise the bed up actually. Should have raised the bed up first. Okay, here we go. And I'm gonna put your bed. And the last right. Okay. And I got you your water. Oh, here are you pocketing. Okay, here I'm just gonna touch your neck so you can swallow. Okay. Oh, okay, here, I'll just give you a straw, okay? So, there we go.
In our perspective, caring for a patient with Parkinson's disease depends on the stage the patient is on, and it needs to be individualized because each patient presents different symptoms. By acknowledging a patient's strengths, validating his or her concerns, and encouraging responsibility, the nurse can help provide a sense of control for the patient.